with the thoughts you'd be thinking you could be another Lincoln if you only had a brain.
Hi, I'm Nick Herrmann.
I'm Melanie Herrmann.
And this is the Brain Change for You podcast. We are continuing with this. Next show, we are talking about LED light therapy. And just a reminder that you are not your brain. And for those of you who are just joining us, neuroplasticity is a new brain science, the ability of the brain to change its own structure and functioning through activity and mental experience.
Okay, so I've been really excited about this podcast, to be honest, because it's on my favorite chapter in Brain's Way of Healing, Dr. Doidge's second book. It's on chapter 4, and it's called Rewiring a Brain with Light, Using Light to Reawaken Dormant Neural Circuits. Now, when I read this chapter on an airplane, I couldn't put it down. I marked up the whole chapter. I had underlined parts, people's names written in, thoughts scribbled through it, because light and the concept of light has been so fascinating to me anyway. And so now to see the application of light into the healing of brain was actually just another clarification of or another witness or confirmation of things, the ways that I feel about light and the importance of light in our lives. And so I'm really excited to talk about this today. Dr. Doidge started his chapter and was introduced to light therapy, low-level light therapy, at a symposium in 2011. And he talks about this at the beginning of his chapter 4, Rewiring a Brain with Light. And the title of the symposium was From Darkness to Light, Clinical Explorations, and it was held by the Ontario Medical Association. So we're going to talk about some of the speakers and summarize just, I don't know, sometimes I don't know how much we should put in to the podcast, what's too much information, what you're interested in. I put the things that were fascinating to me and interesting and the stories that he shared. And then Nick and I will share our own experiences with light therapy, though our experience has been brief. Nevertheless, we'll share what we're learning about that. But anyway, if you stick with us to the end of the podcast, we'll actually show you systems, LED light systems that you can purchase and use in your home with your whole family. And that's kind of exciting because some of the techniques that Dr. Doidge talks about in his book are not yet available to the public. They haven't been approved yet, but this light therapy has been approved by the FDA, and they are available. And I've had some really excellent guidance from a Harvard professor doing a study on brain injury and light therapy, so I'm excited to share that with you. So let's kind of go on a little bit about light therapy, infrared, LED, etc., and we'll give you a little background knowledge. So this is what we came across with guidance. When I was reading in Dr. Doidge's book, of course, I read about a research study going on at Harvard University and Boston University. They're involved with that, and Ontario, anyway, University of Ontario. So they're working on this research study, and they're studying particularly traumatic brain injury, although they study many other neurological challenges and other medical conditions such as cancer and heart disease. But of course, the part that I'm interested in the most right now, because of our personal experience, is traumatic brain injury. So I started Googling and trying to find light therapy systems, in my ignorance, and lots of things come up. And in the end, I did something pretty bold. I emailed a professor that's involved with the study, and we'll tell you about him in a minute. But these are some of the options that I discovered with his help. So hang tight because you'll hear more about this. So Dr. Doidge introduces his chapter with a quote from Florence Nightingale. She says, "It is the unqualified result of all of my experience with the sick that second only to their need of fresh air is their need of light, that after a closed room, what hurts them most is a dark room, and it is not only light but direct sunlight that they want. People think that the effect is upon the spirits only, but this is by no means the case. The sun is not only a painter, but a sculptor. Dr. Doidge then goes on to tell about Sister J. Ward. And of course, this was fascinating to me because she worked around the time of World War II in Essex, England, in a preemie ward in a hospital. So she worked with the infants, and you can see a picture of her there holding an infant, a preemie, and it was so endearing to me because we have our own preemie who's sitting next to me now, and you can see I pulled up pictures of him as a preemie that reminded me of this baby that Sister Ward is holding. But her story was pretty cool, and you know, anybody that's a mother and has had babies understands, well, maybe, I guess this was a good refresher for me on neonatal jaundice, and Nick was under the bilirubin lights in the ICU, in the newborn ICU, when he was a baby. But neonatal jaundice is the yellowing of the skin of the eyes of newborn when their liver is not mature enough to break down the old red blood cells as they are as they get old, and they need to be replenished with new blood cells. And so bilirubin forms and it builds up in the body. And if it's untreated, it can lead to a buildup in the brain and can cause brain damage. And I asked my daughter Tessa, who's a nurse, about this, and she said it's very true. And she told me the name of this condition when you have brain damage from the buildup of bilirubin. But the story of Sister Ward was she would take care of these babies, and she just felt, she had the impression that taking them out into the sunlight would help them feel better and help them heal. So she would take these babies from the newborn ICU, and she would undress them, just leave their diapers on and take them out in the sun and let them bask in the sunlight, and then take them back inside. And the doctor started to notice that the coloring of the babies was changing, and the part of the skin that wasn't covered by the diaper was now returning to a more healthy color than the part covered by the diaper. So, you know, it was interesting because, you know, she said, well, that was the sunlight that did that for the baby. And the doctors kind of blew that off, you know, but then a beaker or a vial or something of blood was left on the windowsill that had a high amount of bilirubin in it, and it was exposed to just accidentally, it was exposed to sunlight, and then it was returned to the lab, and they noticed the bilirubin had broken down significantly. And that's when now they really paid attention to the fact that the sun and sunlight had a healing effect and enabled the bilirubin to break up so that the liver could manage new red blood cell production. And so doctors started paying attention now to this. And so that's how we know Sister J. Ward for her inspiration to take babies out in the sunlight. In Dr. Doidge's book, he kind of gives an overview of the history of the ways light has been used even since ancient times. And I'm only going to touch on a few things. There's so many wonderful things in the chapter that you can read. But Dr. Norman Rosenthal, he does research and work with seasonal affect disorder, and he found that some depressions can be cured by sun exposure, that a full spectrum of light can be as effective as medication for depressed patients and not have the side effects that medication does. And there's a great physician, and Nick, I can't even say that name. Can you say it?
Artaeus of Cappadocia, I think.
From the 2nd century, he said lethargics are to be laid out in the light and exposed to the rays of the sun, for the disease is gloom. Well, that's a really interesting statement, because we do hear about people that live in Seattle where it rains all the time, and there's a high level of depression there. And I know when I wake up in the morning, the very first thing I want to do is open every shutter or window or curtain. And I like the sun. I like the sunshine. I'm happier. I feel better. I function better when I have a lot of light.
That's why the reason it gets so hot in the house.
Yeah, it does. I really don't like. Even in the heat of the day, I like sunlight. But Dr. Doidge says in the book that if sunlight influences mood, as these two doctors above suggest, then it influences the brain. So sunlight can have an effect, and light can have an effect on the brain. Light turns on chemical reactions in living organisms, and we learn about plants.
Oh,
Photosynthesis.
Photosynthesis. That's
like,
the
okay,
word.
photosynthesis and the need of living organisms to have light. And we're not any different than that, are we, Nick?
Mm-hmm.
Okay, but he also says that the skin and skull are not barriers to light, that sunlight actually passes through skin and can influence the blood and the other systems of the body, the blood and the tissues. So there's a little brief history of low-level laser light therapy here. 1965 in England, they were discovering that low-intensity lasers can heal. We'll talk about lasers again in a minute. Lasers can stimulate skin growth. In the 70s and 80s, the USSR had several research facilities that were studying how to stimulate living tissue with laser. And then in 2002, we were a little slow here in the West to get FDA approval to use low-intensity laser therapy devices. So kind of these are the two questions maybe we'll address, and Dr. Doidge has addressed this. Can light therapy help to heal brain tissue that is still sick in some way? Because all of these studies have showed that light therapy can cause healing, and I guess it's new, the idea that it can help with brain tissue. And can it help heal general cellular function of the neurons? And he tells stories about individuals that some of the speakers that were in this symposium. He tells their stories, and he tells other stories, and has personal experience with a woman that had quite a severe brain injury, a brain insult, and we're going to be talking about that.
Yep.
So infrared light, I did a little research on this because this was new to me. So infrared light is invisible radiant energy, and it has a longer wavelength than visible light. In the light spectrum, it's after red light, and red light has a lot of healing qualities. It's 700 nanometers to 1 micrometer. But people, if you move from red to infrared light, you can go to at least 1,050 nanometers. And I didn't know this either, but thermal radiation is emitted by objects sitting in a room, and the energy that's emitted is infrared. It was discovered in 1800 by Sir William Herschel, and he found that there was an invisible radium spectrum lower than red light. So infrared light is invisible, and he discovered this using a thermometer. This is exciting. Slightly more than half the total energy from the sun arrives on the Earth in the form of infrared, and it affects climate and so many other things. And infrared energy is emitted or absorbed by molecules, and it has many uses. So some of the uses are industrial, scientific, and medical applications. This was interesting to read about night vision and astronomy, military and civilian purposes like target acquisition and surveillance. And if you Google that, you can see some interesting images in Wikipedia on infrared and how that's used by the military. It's pretty interesting. But like I said, this is kind of a personal topic to me, so I'm sharing this just a little bit here, and why this excited me so much, because even if you look at the bigger picture than the sun and the stars and the universe, you look beyond that, the bigger picture. I believe in Jesus Christ and that He is the source of truth and light, and that the earth was, and in Genesis we read, and God said, "Let there be light," and there was light. Is that how it goes, Nick?
Yes.
Did I quote it right? Dr. Doidge quotes that in his book too, quotes the Old Testament and the creation of the world. But as I was reading about light, and I've read about light a lot I keep saying I'm doing this podcast about mental health, about anxiety, depression, and controlling our thoughts and recognizing the source of thoughts. And in my study of that, I studied light a lot, both academically but also in scripturally. And I just thought this was such an interesting passage on light. And so I'm going to read it. Then we're going to move on to the science. But this is why this is so exciting to me, because I feel these things. So that it says of Jesus Christ that he ascended up on high, as also he descended below all things, in that he comprehendeth all things, that he might be in all and through all things the light of truth, which truth shineth, the light, and this is the light of Christ, as also he is in the sun, and the light of the sun, and the power thereof by which it was made, as also he is in the moon, and is the light of the moon, and the power thereof by which it was made, also as the light of the stars, and the power thereof by which they were made, and the earth also, and the power thereof, even the earth upon which you stand. And the light which shineth, which giveth you light, is through him who enlighteneth your eyes, which is the same light that quickeneth your understandings, which light proceedeth forth from the presence of God to fill the immensity of space. The light which is in all things, which giveth life to all things, which is the law by which all things are governed, even the power of God who sitteth upon his throne, which is the bosom of eternity, who is in the midst of all things. This kind of gives you an overall picture of really the vastness of light. And Dr. Doidge talks about everything that light is in. And, we just read about infrared light in the universe and in the sun and on the earth. And the light, this is, I believe, is the source of light is Christ. And it makes perfect sense to me that that light could heal, could heal not only physical bodies and physical ailments, but light heals our souls and our spirits, because that's all part of the creation and the world and the universe. So this idea of light is a big thing to me. That's why I'm so excited about this. So, okay, this man right here is Michael Hamblin. He's the professor that I was going to tell you about. And when I was reading chapter 4, and I read about the research study, I thought, I told you I started Googling and looking for light systems, and you can go to Amazon, and I thought, okay, how do I know if this is a gimmick or what? So I thought, I'm just going to look up this Michael Hamblin that Dr. Doidge mentions, and I'm going to email him. Can't lose, what can it hurt? Might as well try, right? Might as well try. I'm just going to email him and see if he can give me some guidance. So I sent him a short email just saying I read Dr. Doidge's book. I read that he was doing a research study on traumatic brain injury. Wondered if he was taking any more subjects, because wouldn't that be a great trip to go on, Nick? Yeah. So go back to Harvard and
meet all the rich people. Just kidding. The smart guys.
The smart guys. Harvard and Boston University, etc. Meet all those people. No. Be involved in a study. That would be awesome. But he just sent me this immediately, almost within the hour, replied and said, most people buy the systems and use them at home. I'm like, oh, great. Okay, we don't have to go to Boston. So then that's when I started Googling, and I didn't find what I needed to know, because I wanted to feel confident in what I would purchase, and I wanted more information. So I took a chance and emailed the give, and I said, can you direct me to a website or a link or a model? And so he sent me the link to LED Technologies, and I had several conversations with LED Technologies, and voila, now we own an LED Technology low-level light therapy system. We'll tell you about that. But this is Michael Hamblin, and he's involved in this research study, and this is what they're showing, that this red and infrared wavelength is doing to help with cellular photoreceptors. Yeah.
Something
okay, so
skin receptors.
Yes. Okay, so wound healing, tissue repair, prevention of tissue death. Okay, you can think about this all over the body, all over internally and all over the body, but you can also think about this in the brain. Relief of inflammation, pain, edema, acute injuries, chronic disease, neurogenic pain, neurological problems, acupuncture. These are some of the things that are some of the uses of this low-level light therapy.
So with low-level light therapy, it all started with Dr. Fred Kahn, who was the first speaker at this convention that Dr. Norman Doidge was at, and he spoke about high-intensity lasers that burn through flesh, do a lot of damage, kind of
Like kind of like
scary.
the Star Wars idea.
Yeah, Star Wars idea, scary
Like
things,
James
zap
Bond.
zap. No, he would talk about that, and he said there's that, or there's low level light therapy or low level intensity lasers that help the body, help the body's energy and cellular resources to heal themselves with no side effects. How he started was in just before World War II. He lived in Germany, and he lived through a time where the Nazis would come in and burn all the churches, burn all the synagogues, and then bring all the Jews into concentration camps. And his family, thankfully, were able to escape through through a pretty hard time to the Americas. They escaped to Ontario, I believe, and his family was raised as farmers. He got a whole lot of sun. He worked in the sunlight. As he was growing older, he would swim for several hours a day, just get as much sun as he could. He was a neurosurgeon, and he did amazing things. But given his circumstances, he was also a skier, and he messed up his shoulder pretty bad. And he talked to other surgeons, and they said, well, yeah, you're going to need surgery. And being a surgeon himself, he was just like, surgery, they're going to cut me open, they're going to rip me apart, sew me back up, I'm going to be in a lot of pain. No. So he was able to go down to Texas. Right?
I don't know. I don't remember.
Yeah.
Nick. I hope
he was
you're
able
right.
he was able to go to Texas and learn about low level light therapy with some other famous doctors, and he was just so intrigued and amazed by this that he gave up all his surgical lifestyle that he had been raised on to study light, which is pretty amazing. So
yeah, it said he'd done like 20,000 surgeries.
Yeah,
and
he was really famous, really good at what he did for the community, being a surgeon, and he gave up his industrious career to study light therapy, which in my mind, when I read that, I thought it was a little crazy. I mean, you have such a great career, and you give it up for something that you want to learn about, but you don't know. But he gave it a lot. He was an amazing man. Gave a lot of it. He was an amazing man. He studied light therapy, and he was able to help people with low-level light therapy. And low-level light therapy helps with just regenerate and energize the body, skin, tissue, blood, and other things to heal themselves. The second speaker, Anita Saltmarsh, she also studied light therapy for quite a few years, and she has extensive experience in product development, regulatory affairs, education, developing protocols, marketing related to laser and light therapy. Basically, she works with light therapy. So she would work with light therapy, and one patient that they were working on, I believe it was another doctor, she was in a car wreck, pretty severe car wreck. She smashed up her knee. She got severe whiplash, which gave her a brain injury. And this doctor lost pretty much everything she was good at. She struggled with speech. She struggled with sleep. She have angry outbursts all the time. And so she was brought in to these therapists, light therapists, to help her with, healing with her jam knee at first. And it's amazing how light works. Within 3 to 4 sessions, her knee was better, and she was just like, well, does it help with the brain? Does it help with the head? Will it help with my whiplash? Will it help with anything else? So they tried that, and surprisingly, after a few sessions, I can't remember the exact number of sessions, but after quite a few sessions, she was able to regain her speech, sleep better. After her accident, she was able. No, that's a different story. I'm sorry. She was able to sleep better. Her angry outbursts definitely calmed down. And this light therapy, as she continued to do it, healed her. And Anita Saltmarsh worked with Margaret A. Nazer, who was a principal investigator. Margaret, research professor of neurology, Boston University, and they were able to work together and learn more about light therapy.
And they were actually the ones doing the study with Michael Hamblin, the gentleman that I wrote to. And so the three of them, and I'm sure other scientists and physicians, etc., are involved in this study. So a problem. Okay, what were the problem? We have injured bodies. When you have an injured body, and it can be any part of your body, the problem is it has a lot to do with the inability of the body to supply the damaged tissue with blood. And circulation is always a problem, and it's necessary. Circulation is necessary for the body to heal itself. And so one of the great things about low-level light therapy is it helps with circulation. So here's some examples from Dr. Hamblin's work. There are wounds of this. No, I'm sure this is from Dr. Kahn's work.
Yeah, Dr. Kahn.
This is his
work. This is what Hamblin has talked about and studied. He's studied Kahn's work, and so this is what Kahn
has found. Okay, so it has been beneficial to wounds of the skin, gashes, herpes, shingles, burns, psoriasis, eczema, gangrene, tissue wounds such as torn hamstrings, ripped Achilles tendons, osteoarthritis, rheumatoid arthritis, herniated discs, sports injuries, traumatic brain injury, folded, psychiatric disorders, nerve injuries. And like I said, Michael Hamblin had been studying low-level light therapy to treat cancer and cardiac disease, and so now he's a world-renowned expert in this, and now he's studying brain injury. And he's a very kind man.
Yes.
Because he responds to all of my texts. Even when I clarified, I was doing more research on difference between laser. Dr. Doidge talks a lot about laser therapy, and at the same time LED. And so I'm thinking, is it really the laser therapy that's more effective, and the LED isn't as effective? So I had to clarify that, especially before we made this podcast. So I emailed Dr. Hamblin yet again, and he replied very quickly and assured me that LED light has the same effect that laser light therapy has. So we're going to show you the light devices that he recommended and we're using, and they are, I'm a little more confident in that than investing in a laser and trying to do that. So, but now, Nick, why don't you tell about? So Dr. Doidge introduces his whole book. There's so many stories; it's hard to get keep all the stories straight,
correct,
and all the people. But a significant the title of the story. What was the title of the chapter? Is specifically about this Gabrielle Pollard, who Dr. Doidge noticed as he walked into the symposium on light. He noticed this woman, this attractive, dark-haired woman, walk in to take part in it, and she was walking very slowly and in pain. And so he kind of, from watching her walk across the room, he assumed, or or felt that she probably had a brain injury and was
Mhm.
there for information. And interestingly enough, she walked right up to Dr. Doidge and introduced herself, said, "I'm Gabrielle Pollard, and how do I know you?" She recognized him. She didn't really know how. And
And
they
he didn't
chat.
recognize her.
He had
either.
no idea who she was,
Yeah.
but they chatted for a minute, and then all the symposium started with the speakers such as Kahn and
Saltmarsh. Yeah.
They all spoke. Okay, so then Dr. Doidge comes back over time and first tells about Gabrielle. So why don't you continue with her story, Nick?
So the story I was telling, her story is, that she was slow, she was in pain, and Gabrielle, I know if you're watching this, if you find this on our YouTube channel, you can definitely give me a call and correct me on anything I get wrong. I'm just trying to tell you your story the best that I've read about, so please forgive me if I get anything wrong. So basically, Gabrielle, she had pain. She had trouble concentrating, multitasking. She had a hard time holding her head up because of so much pain, etc., etc. And she started doing this light therapy after the symposium.
But give her a background first. She told Dr. Doidge her story, and what was the cause of her brain injury?
A car accident.
No, Gabrielle. No. Okay, so Gabrielle.
Oh wait, no.
She's the one that had the tumor.
Yeah.
So Gabrielle, back in 2000,
she started.
There's lots of stories.
Yeah, Gabrielle, back in 2000, 2001, 2002, she had a brain tumor on her spinal cord, just right where your brain meets the spinal stem.
So your brainstem, where?
Yeah, your brainstem.
Yeah.
And basically, it caused a lot of pain. Because of this, she was in a lot of pain. Again, like I said, she had trouble concentrating, multitasking, holding her head up, and she was told to get surgery, but of course, that surgery to get that tumor removed would be very, very delicate. It was very hard work, very delicate procedure, trying not to, tweak something or tear at something that would cause her to
die. Pretty much.
Pretty much. And, thankfully, she was able to have the surgery. It was able to go well, so it saved her life that she had the surgery. And so soon after that, she started this light therapy after the symposium. And
well, between the surgery and the symposium, it was a couple years had passed, and since her brain surgery, and she had, even though the brain surgery had saved her life, the removal of this benign tumor had saved her life. She was having definite neurological challenges, like nausea, like throwing up
all the time,
balance,
concentration, multitasking.
She couldn't walk. I mean, she couldn't drive. She could walk with a walker.
So basically, it was a lot of pain for her. God bless her for being able to have this happen to her, because it's definitely something that works. So soon after this light therapy, she had light therapy on just pretty much anywhere that she was having pain. After 8 weeks of this treatment, low level LED light treatment, there was also low level laser. But for those who are concerned with lasers, and the sound of laser just doesn't sound very friendly. So what Melanie was saying in the slide before is that they have LED now. Anyway, after 8 weeks of treatment, she was able to, this quote that she wrote in a letter to Dr. Doidge, She says, I cannot remember, concentrate, and multitask. I have mental clarity. I can fully rotate my head to the left and bend over. Remember, she had trouble holding her head up. She can listen to the radio. Her hearing issues came back. She can listen to the radio, sing, use the shredder, basically do everything in life. Go to restaurants and shopping malls.
Yeah, so her problem also was the sensitivity,
sensitivity is a lot,
to sound and noise,
sound,
and like
noise,
a shredder,
light, yeah.
or the busyness of a mall, or even the music or the radio was just torture for her. Yeah.
She returned to her church, and the microphone was there with the sensitivity to sound, didn't bother her anymore. She's back doing exercises in the swimming pool. She can deal with screaming kids, ghetto blasters, whatever they were.
Boom
boxes. I guess. Hair dryers. Just so sensitive to her. She can be able to deal with that. She can walk faster than her dad on good days. She's a lot stronger. She's hoping to be able to drive again. This was a quote before. It was very exciting for her, and of course it took many months to get this.
Earlier, but now.
Yeah, but now earlier it took months, but now it takes 2 to 3 days. And speaking of what Melanie was saying, she hasn't thrown up since 2012. In a later PS note that she wrote to Dr. Doidge back in October of 2012 is that she drove by herself for the first time in 3 years.
So, this woman has given back her life after this light therapy treatment. That's pretty exciting. That's pretty exciting to me to read that, and so I got excited, and we ordered these lights that Dr. Hamblin recommended. And this is just shows you what this LED light company, some of the systems that they have. Now, the one that we got is the one that looks like the laptop, and I'm gonna have Nick. We're gonna enlarge the screen now, and we're gonna show you this. Well, actually, let's go to the next screen first, because this is brand new. Well, the system standing up, the black one that looks like a laptop on a stand, is actually
this right here.
Well, no, the one above that is the old one that is they just stopped making that. That was the one I went online to order, and they told me that they made this new one that Nick's holding up, and that was by far the better deal, because the one that you see here, the black one, had red and infrared light, but now this system that Nick has is able to you're able to access blue light, red light, infrared light, and amber light, and each of them have different healing attributes. The most important, of course, if we were purchasing these for brain injury, most important attributes or the most important lights or spectrum that we need is the infrared and the infrared. But as I learned after receiving this and studying more, there are benefits for other lights, and we'll tell you just a little bit about that. But the focus, just know, is on traumatic brain injury. So this, Nick, okay. Okay,
we're going to go to a bigger.
Okay.
We're going to go to full screen now, so we'll be able to show you.
Okay, this light panel has 220 LED lights, and you have the option of going from blue light, which blue light is actually used to kill bacteria, and a lot of beauty salons,
cosmetology.
Yeah, they're using that for acne and acne treatments and things like that. So you might have heard of laser or LED light treatment. If you can go into the salon and have that. Okay, so amber light is also helpful to revitalize tissue and complexion. So these are kind of cosmetic. The blue and the amber are kind of used for
cosmetic reasons.
Yeah, but you know what? When we got this, I was like, okay, oh my goodness. Well, we got it for Nick to see if we can help with his sleep and decrease the inflammation in his brain, which helps you process things better, because a stressed brain, overworked, tired brain, noisy brain that Norm Doidge talks about is an inflamed brain. So you can lower inflammation, which is one really
one
important.
of many.
Yeah, that red and infrared light
Yeah.
does. They lower inflammation, increase circulation. Anyway, so my focus was on the red light and the infrared light. But you might as well have the benefit of having the system that has everything.
Yeah.
So our family has been using it for a lot of different purposes. So Nick, how do you enlarge this? Okay.
I'll enlarge the screen now.
Okay, so now we're going to show you this. It looks like a mini laptop.
So this
Here, I'll hold it.
Okay.
Here.
This is what it is. This one is actually made by Revive Light Therapy Company.
Which is actually LED technology.
Yeah, LED technology.
Just
So
their
this
partner.
is low level light LED technology. Not laser treatment.
But it does the same
But
thing.
it does the same thing as the laser treatment. So what I'm going to do now is I'm going to set it. There are 4 different settings on this one: the red light, the infrared light, the amber lighting, and the blue lighting. What I'm going to do now is turn it on the first setting, which is infrared red, and I believe
Just infrared and red.
infrared and red
Yeah.
lighting. So
And
I'm going to get blinded here for a minute. Ah!
Okay, you can show.
So you can't really
Oh.
tell on the screen, but you can definitely tell that it's lit up. For those who can't tell, it's red and infrared light, but it works.
This is the setting. So this is the setting.
This is the setting I use to help me sleep at night. It's a 15-minute run. They'll shut off. You let it cool for 10 minutes, and to do the same thing. So basically, you can do anything like hold it like a tent over your head, over your face, over your shoulder. I had a shoulder surgery, so I should start putting it on my shoulder because my shoulder has been really achy lately. My knees. You can basically do it everywhere.
But specifically for brain injury,
yeah.
is on the back of the neck. This, according to Dr. Hamblin, back of the neck, brainstem, kind of where Gabrielle had used her lights, and also in the face. And the research that I was doing online also says the face, because the light enters up through your nostrils and has even a better access to your brain. So you can do it on your face. Nick does it on his face 15 minutes, on the back of his neck for 15 minutes.
Yep.
At the night and in the morning?
Yes.
Okay.
And so this is what it is. This setting is infrared and red light. I know you'll probably not be able to see the different other settings. There's blue. See the light's blue on my face.
So my teenagers have used this for acne. They actually everybody in the family's been trying to use this. So they've been having little sessions with it on their face. It also comes with a stand. You can set it on the table and sit in front of it.
Yeah.
I think
if you don't want to hold it or have it, yeah.
The closer you can get to the light, the better. So we put it on our face like the books. That's what they directed me to do.
Yeah. So there's this setting. There's this very colorful setting, purple, infrared, blue, and then that's pretty much it. But man, my eyes are definitely ringing color. But this one was made by Revive Light Therapy. They are under
actually
the same...
Nick, I'm just going to correct you.
Okay, correct me.
It's LED Technologies.
LED Technologies.
This is their second company.
Yeah, this is their second company.
So they're
Revive.
just selling it through
Thank
Revive. You can look on both of their websites. But when I talked to them, I was like, "Did you know that your lights are being recommended by a Harvard professor doing a study in brain injury?" And they had no idea. They were really excited to hear about Dr. Doidge's book. So they sent me some information on indications for use for muscle spasms, minor muscle joints, aches, pain, stiffness, arthritis. It increases blood circulation and accelerates healing for arthritis, spasms, all these things listed here. And so we'll get you a little more personal about what we've used it for. Yeah. So Nick said what he's used it for his for brain injury. Now, what are you on the back of your neck and on your face, and what are you feeling or seeing from that? What results?
The results I'm seeing, I told about this earlier in the slide, is that I'm able to sleep better. Definitely be able to sleep better. I would constantly, for me, falling asleep and staying asleep has been a struggle my whole life. there'd be times where I wouldn't be able to fall asleep till 3 a.m. And then I'd sleep in. But anyway, so now I'm able to fall asleep at 10 o'clock at night and sleep throughout the whole night, without, which is amazing because sleep. I love sleep. And then I constantly get headaches from stress factors throughout the day. So I use that as light therapy as well to get rid of my headaches, and my headaches have gone away.
So, a few days after we got the lights, our other son was out playing basketball and he rolled his ankle, and he's an athlete and had some coming up. He had to have that ankle healed. So we got the lights out, and he had several sessions with the lights on his ankle, and we were thinking, we're going to have to get crutches, take him to the ER for the last week of, he's going to be on crutches for the last week of school. And he was walking, he missed a couple periods the next morning, but he went to school walking gingerly on it. But by the next day, he was walking on his
within
foot.
2 to 3 days, he was walking like normal.
His ankle was sprained, but he was up and moving and not using crutches very quickly. Yeah. That was interesting. There's a man that I do neurofeedback. Well, actually, I do neurofeedback for his daughter who has had brain injury from a car accident, and talked to him about the light therapy. He is 72. He broke his ankle in January and had surgery. And for though he's healed and walking, he says it's been a constant kind of ache for since the injury. I mean, of course, pain early on, but even though he's up and walking and healed, he has kind of constant pain. He ordered the lights and started using them on his ankle, and his pain for the first time since his injury went away. So, and I got to say, I'm taking advantage of the anti-aging setting, and I like to put them on my face at night after I get in bed, and it's kind of a good time to do breathing exercises, meditation exercises, and to think and pray. And I lay there with the lights on my face, and I'm just feeling really calm and comforted with them there. So I don't, that's a little aside.
That's a little aside.
That's a little aside.
But
anyway.
But it definitely works.
We've been seeing cool things. Of course, we're excited, but long term, we're going to have to report long term how things go. But now they have a few
updated versions.
Yeah, and I think this is just coming out in June. And now there's this flexible system that you can actually strap around a leg or a shoulder or elbow that's been injured, and this is a more affordable, and so that's an option. And these handhelds are options that are also more affordable, and I think they have different light
settings,
fixtures you can buy, so that you can buy if you're interested in the blue, you can buy a head that has a blue lights, or with the infrared. What I like about the system we got is the professional system, and it has all the options in the one component. It also has 220 LED lights, and I think these have 60. So for whatever reason, I think more is better. But I don't even know if that's true. So if you're interested, actually, Nick, you can talk about this.
So if you're wowed by this presentation, I know it took a little longer to get the information out, and we apologize. We will definitely narrow our next podcast down, try to keep it more concise. But there's so much information that we want to get out that it's definitely helpful. You can purchase these light therapy systems with at LED Technologies, who also do the second hand, their sister company, Revive Light Therapy, professional panel system. You can order it there for $349 plus shipping. You can find their links to the bottom there. Check those out. It's really neat. But we actually contacted them, and we actually contacted LED Technologies and Revive Light Therapy and discussed, we're doing these podcasts, and we would like to help them, distribute their lights. So they gave us permission, and so if you want to order them from us, we can do that. We are now a new distributor, so we give a distributor discount. You can order the lights for $319 plus shipping.
That's the professional system.
Yeah, that's the professional system, the one we showed. To order those, you can call me, Nick Herrmann, area code 435-232-1704. And if I'm not available, you can contact Melanie at area code 435-754-4959. We'd love to take your questions. Please feel free to email us at brainchangeforyou, brainchange, the number 4, YOU, @gmail.com. And you can also call us and leave us with questions. If you have any ideas for our podcast or any questions, we can definitely answer them on our podcast. And again, if you want to order these LED light therapy professional panel system for $319 plus shipping, you can call me or Melanie.
Also, if you want more information on the other options, we don't have those to show you because this is the only one we've purchased. But you can go to these websites and look at those. And if you're interested, they're more affordable systems. Like I said, they don't have as many lights or as many options, but they're a more affordable option. You can also order those from Nick and at a discount from the price listed on their website. So we're just offering a discount and hoping that if there are people that you know that this could help, that you'll share this webinar or this podcast. This podcast with them and recognize that we are just your Joe average
podcasters.
People here. You get us as we are. We try to put together these PowerPoints to be helpful. We're kind of, we go do
learning off the cuff, and we're learning as we go along. So we're trying to get advice and everything. Advice, everything, help. But if you want to order from us, $319 again. You can call me. You can, if I'm not available again, you can call Melanie, and we'll be able to bring those lights to you, and hopefully that you can be able to learn and enjoy this product as much as we have.
Yeah, and also you can tell us if you think we're giving too much information, if the podcasts are a little too long, let us know that too.
Yes.
So we can kind of refine. And I just got to say, I love this picture here on this screen. This is Nick and Elizabeth. Elizabeth is the girl with missing part of her brain that Dr. Doidge wrote about in his book, and she actually came to the event in Salt Lake City.
Mm-hmm.
And so Nick we got this wonderful photo of her and Nick in front of the book signing table. I love that picture. So I had to throw it in there. Anyway. Yeah, these neuroplastic guinea pigs. Way to go. Anyway, we hope you have a great day, evening, whatever. And if we can help you in any way, let us know. Signing out. Thanks.
All right. Thank you very much.